With beach season quickly approaching, we all need to pay even closer attention to how much time we're spending in the sun. Dr. David Reid, a plastic surgeon at Hilton Regional Healthcare, joining us. Welcome in, Doctor. Good to have you here.
Thank you so much. Thanks for having me.
What's the easiest way to pay attention to how much sun we're getting and the potential for skin cancers to develop?
Well, of course, while you're in the sun, you need to keep sunblock on, usually SPF 30 or greater. You need to pay attention to how hot you are and, of course, stay hydrated.
Yeah.
And if things are too hot, they probably are.
30, though, is probably the minimum number that folks should be thinking of when it comes to sunblock?
Yeah, usually for definitive sun protection,
Yeah.
30 or greater is the way to go.
Okay. How can a bad sunburn cause skin cancer?
Well, it will eventually. It won't cause a skin cancer that day, that week, or that year, but the radiation exposure that causes skin cancers is cumulative and life-lasting. Lasts for your entire life.
Sure.
So it won't cause skin cancer right away, but it will probably decades later in a number of people.
Okay. Well, now, what does skin cancer look like?
Well, there's a few varieties. The most common is basal cell, and shortly thereafter is squamous cell. And those two can appear as a non-healing wound, a little scab or crust, something that just doesn't heal within a month's time.
Okay.
Those warrant examination by your physician or your dermatologist.
Absolutely. Where do we usually get skin cancers? Where does it show up?
It's most common on the face and neck, but it can occur on any skin, anywhere on the body.
Okay. What are a couple simple ways to help prevent it, besides obviously sunblock?
Well, sunblock, and then of course, when you have things on the skin that show up and they don't go away within a month or two, that's when you need to go see your physician about looking at those and possibly getting a biopsy if need be.
Okay, that's just kind of an alarm that should go off with you for sure. When should we see a doctor? Should we see a doctor maybe even if we don't have one to establish a baseline if we don't think we have a cancer to establish something to work from?
That's a great idea,
Yeah.
especially if there's a family history of skin cancer.
Okay.
So the other thing is, I don't want to leave out melanoma. We talked
Okay.
about basal cell and squamous cell briefly. Melanoma is a much more serious skin cancer, and that typically looks like a mole that's changed, particularly one that's dark in the black or brown realm, especially if it has so-called variegated color, which means different colors within it, especially if those colors are red, white, or blue.
Okay. Melanoma, obviously the most serious of the cancers we're talking about.
Absolutely. That's the
yeah.
one that if one's going to kill you, it's more likely to be a melanoma than it is the other two.
I was just going to say, the other skin cancers, we've got a pretty good treatment track record going, don't we?
Absolutely.
Yeah, all right. Well, thanks so much for clearing up some misperceptions and providing us with a little guide for summer sun worship. Dr. David Reid, plastic surgeon at Hilton Regional Healthcare.